Professor Elizabeth Ann Bukusi is a researcher at the Kenya Medical Research Institute, and Winnie Wadera Kiriga is a life skills facilitator and a member at RAE Secretariat. Good morning, ladies.
Good morning.
Good to have you on Kenya's biggest conversation this morning.
Thank you.
It's cold out there. It's warm in here, right?
Yes.
It is warm in here, without a shadow of a doubt.
Not hot.
No.
Not hot.
Comfortably warm.
Well, I think this show is very hot.
That's what they say.
One has to keep asking who the good professor has been speaking to. This
Surely.
well-natured, good-natured show at the hot.
Hot.
Who says? Surely.
You won't go. You won't go.
It is hot. You talk about hot topics.
Yes.
So
Like
it's
this
very
one of
hot.
today's
Like this one of today's is certainly hot.
is a hot topic.
Yes.
I want to start with you, Winnie.
Yes.
RAE Secretariat. What's that?
Thank you so much for having me on the show. RAE Secretariat is a project under Impact Research and Development Organization, which is a non-state organization conducting medical research in the greater Western Kenya. So we are based in Kisumu. That's where our headquarters is. And so RAE stands for Reducing HIV in Adolescents and Young People. And that's a project we have been conducting, especially targeting young people in the sub-Saharan African parts, And so we mentor young people who have interesting ideas around curbing HIV, so prevention, care, and treatment, because we believe in two things. One, young people are very innovative in terms of coming up with creative ways to address the menace of HIV. So they can already tap into the existing interventions creatively. That's one. Number two is they can come up with their own creative ideas to addressing HIV. And so that is what we have been tapping into for the past 2 years. And 3 weeks ago, we conducted an international conference inviting adolescents and young people from different parts of East and Southern African countries. And it's very, very exciting. We've seen young people come up with interesting ideas. And right now we have something called the 30 Under 30 Award, where we are sponsoring young people by actually giving them grants to run with their ideas, so in form of research.
All right.
Yes.
Before the good prof comes and gives us the overall figures of the research that, of course, she conducts on a daily basis, your own experience on the ground, we have seen the news lately, concern of a rising rate of infection in HIV and AIDS among the youth and adolescents. These are the people that you deal with on a daily basis. Is it what you're also seeing on the ground?
It is true because, first of all, the biological composition, adolescent and young people's bodies are not quite developed. So, of course, they're susceptible to, for example, tears when it comes to HIV and, and sex. And I don't know if that's, right to use on the breakfast show.
It's a word to use. Yes.
Yes.
Mm-hmm.
And
You
so...
do know we tend to have politicians on this show, so the limits that you speak of don't really exist. So please carry on.
All right, thank you. Yes. So adolescents and young people's bodies are not quite developed, and so that puts them at risk to HIV infection. And then we also know that young people cannot quite negotiate, especially for safer sex, because of confidence issues, self-esteem, speaking up for themselves. The negotiation skills are not quite developed. And so that makes it true. And another thing is youth-friendly services to access to HIV prevention and care and treatment has been a challenge because there's a lot of prejudice. For example, you can be asked as a young person wanting to get tested, as an adolescent wanting to get tested. Can you imagine walking into a health facility? Sometimes, there are myths and facts around stigma, and you being asked, oh, why do you want to get tested? Have you been promiscuous? And so, there's a lot of prejudice and fear. So young people don't quite, are not very motivated towards getting services. And so that puts them at a risk. And so on and so forth. There are a lot of issues that actually make it true and factual towards the prevalence of HIV amongst adolescents and young people.
Okay.
Yes.
Prof, now give us the statistics.
Thank you very much. One wonders why the concern about young people. Now, Kenya, sadly, one of the things we're still leading in, we are still in the top 5 of countries that have the most numbers of individuals infected with HIV. And where is it that we're seeing the highest numbers of new infections? Among young people aged between 15 to 30. Young women are 3 times more likely to be infected compared to young men. So the young men in this age group, the HIV prevalence is about 1.2. For young women, it is something like 5.4. What does that mean? If you think about it in hard life terms, it means you're thinking about one young woman, probably in every 10, every 20 is likely to be infected. When we have these kind of numbers, it means we will still have babies who are likely to be born with HIV. We are not only concerned about HIV, other sexually transmitted infections as well. Even as we are finding new ways of preventing HIV, and pre-exposure prophylaxis, PrEP, is one of those ways, we are seeing very high levels of other sexually transmitted infections. Why does this matter? This matters because some of these infections are the ones that are associated with lifelong challenges like infertility, inability to be able to have children when you're older or when you now want to have the children. They cause a lot of morbidity, in other words, ill health. And the problem is this age group is sexually active. They are the individuals who are likely to be having sex. They are our productive people who are going to impact on our economy. When they're unwell, when they're infected, it means we're losing our soldiers even before we've started the fight. So that is why there's a need to be concerned. Winnie just told us it's hard for many young people to access services. The first assumption is somebody is promiscuous. It's a terminology you don't really want to use.
Yep.
And the reality is you can only have, maybe you only have one partner, but that one partner, because they've had another, puts you at risk.
I mean, there's, even as we look at this, there's so much talking about, okay, there's the confidence issues, there's the self-esteem issues. So there's no search for knowledge because you don't want to ask these questions about this thing that we don't even want to talk about. So there's that side of it, Winnie. But then now looking at the numbers that we're talking about, is it for lack of information? Or is it for fear of something else? I mean, looking at other studies that were done, we have young people who are looking for I've lost the word. We're not looking for protection, rather not looking for condom use, but are looking for I've lost the word.
Contraceptives.
Thank you. Contraceptives after. So the fear of pregnancy far outweighs the fear of sexually transmitted diseases.
You're very right. But to make it even worse, let me just say that, and I want to speak from the young women's perspective for this one. The young men will forgive me. Even though this is a concern for all genders, and we do want to talk about the rights of people, that people do have the right, first of all, even just to information. But 60% of young women, their first sexual encounter is not consensual, and they didn't want it. It was date rape, or it was forced. They're coerced to the point where they feel they can't say no. And the age of sexual debut for young people in this country, for young men, it's about 17. For young women, we are talking about 15. Now, think about a 15-year-old. That's a person who, depending on where they live, in the rural areas, they're probably still in primary school. In the more urban areas, this is a person who's just entered high school.
But isn't it more worrisome now then? Because if we're also saying that the age of this sexual activity, onset of sexual activity, is much lower than it was, say, 10 years ago, say 15 years ago, because then the risk of infection of HIV then is real at a younger age. Because if it was 15, I mean, we have horror stories of 9-year-old, 10-year-old girls then now who are looking for emergency contraception. And now we're looking at these numbers now with the infection rates of HIV. Isn't that then something then that needs immediate interventions now then in terms of this information that we're talking about, Winnie?
Yeah, that's true. And just like Prof has said, sometimes the barriers are beyond just behavioral. Sometimes it's the policies and frameworks. For example, the age barriers or limits towards accessing contraceptions for young people. And already you see that, young people are having sex, adolescents and young people are having sex. And yet, by law, you're not supposed to be on contraceptives. So, the contrast and that as we're still debating about that, still more and more young people are getting infected, and they're dropping out of school because now they're getting pregnant and all this and that. So the contrast is there, and that's why we are saying as young people it's important that we are adolescents and young people are involved in terms of policy influencing, planning, and strategizing, and just reviewing, all these laws and that are there that are discriminatory and posing a challenge to better healthcare and quality of life.
I want to take it back, if you allow me, to just say, why should people be concerned about this? For every person who ends up getting infected, it means treatment for life. That's a cost. That's medication. For them to be able to stay well, stay healthy, stay productive, they are going to need to remain on antiretrovirals for the rest of their life. So for every infection we avert, it means we have a saving. So this is the reason why we really need to put in effort into ensuring these young people stay HIV-free. And Winnie talked about it. We're talking about prevention. Don't get infected. If you do, we want to make sure you get tested, and then you get shunted into treatment so that you're able to access the treatment you need. But the goal is, can we keep those who are HIV-free HIV-free? What are the options? And one of the key factors is parents and older. I like the proverb that you just talked about. Ask those ahead of you, whether it's in age or whether it's because they know. Parents need to be able to engage with the young people about these issues. But this is a taboo subject that nobody wants to talk about. Sex is that thing that everybody does, but nobody wants to mention it. You and I being here, we're evidence somebody somewhere had sex.
Yeah.
That's how someone got pregnant. That's how we were born. Nobody wants to face that fact.
Nobody wants to talk about it. But Prof, why is it alarming now? When we saw this in the news the other day, we said Kenya has been running HIV and AIDS awareness and sensitization programs for more than 20 years, at least intensely, right? Very many of the people that we're talking about now, being adolescents and young people, have been born within that time. And were born of parents who are aware, are the consumers of all that government effort to sensitize and create awareness about HIV and AIDS. So you'd expect that this new generation that's growing up, they're growing up in this environment where there's a lot of information, that there is HIV, yes, that there is AIDS, yes, and this is what you can do, yes, that there is treatment, yes, that there is prevention methods, yes. So why is there a rise in the infection of young people? Why now?
There are a number of different factors. Indeed, these are individuals born within this era, and one would assume that they get enough information. Human behavior is very difficult. We are now in the middle of the year. If we were to take a poll of how many people made New Year's commitments to exercise, Eric, I should start with you. You're looking guilty. That they would be exercising three times a week.
I didn't put myself through that.
They would cut down on the red meat they were eating. And how many of them are there now? Very few.
Yeah.
Human behavior is not something that you do once. It's changing your lifestyle to fit certain things. That's one. Number two, the information that's been coming may not necessarily suit the needs. And Winnie said this, and this is what Ray was about. Nothing about us without us. I may make a wonderful product, but however, it doesn't suit your needs. You don't like it. It doesn't fit your lifestyle. You are not part of the co-design to help me be able to figure it out. Right. But the third thing, the COVID pandemic has really hit people hard. There's been a challenge. People are financially in difficult circumstances. In addition to that, accessing services has been very challenging during this period. So there are many shifts that have just made it so much more difficult for individuals. And maybe Winnie can add to that from her point of view.
From the challenges that you see down there in the community, what is it that the youth are facing?
I think, just like Prof said, human behavior is very difficult. And young people, especially now with the morbidity and the trends amongst young people, for example, the ABCs of addressing HIV, one is staying loyal to one partner has been a challenge amongst young people and older people.
Everybody.
Yeah, and another bit of abstinence has been a challenge, especially now with the statistics around sexual abuse and all that, and not just not just abstinence. Sometimes, it's not invited, like it's non-consented, sex, and so it's not very easy to curb HIV amongst young people. Also, with the fact that the young people, we have limited information. Rather, the things that interest us are not quite the things that we need to know. Like we are, hanging out, being on TikTok and social media, we're following trends on celebrities and all that, not quite in touch with information that affects our health, our lives. And by the time we wake up, it's, oops, I'm already, a person living with HIV. And so also the challenges of adherence. Young people today, we go out, we party, we drink, I forget to take my ART, and so just keeping up with that habit of discipline has been a challenge and continues to be a challenge amongst young people.
There's an interesting thing about this age we live in, this information age. It is a blessing in many ways, and in many ways one could even refer to it as a curse, because there is so much available. Your processes of making choices are completely challenged. You think it is young people who are confused? Older people are equally confused, because there's how to bring up your children in the way that you are brought up. That's called traditional. There is the way you see that is termed as modern. There is what you have read somewhere in some pop psychology and you believe that this is the way you ought to go about it. There is so much information available that you're spoiled for choice. And yes, you're right. Diseases and things that have to do with diseases, just the morbid nature of that conversation makes it something that someone wants to avoid, unless you absolutely have to. For instance, if you look at care-seeking behavior among men more or less have to be on their deathbed for them to actually go to hospital. Literally. Now, on the other hand, you'll find women don't actually have that same attitude towards healthcare. They approach healthcare from a far more open and a far more acceptable way. Now, how do you get young people, young men, let's say for instance, to change the way they have, to change so that they are not quite what their fathers were or what their grandfathers were? Winnie, this issue of involving young people, let me ask the question instead of making a statement. How do you think young people should be involved?
Mm-hmm. Well, multi-sectoral approach. And I'm sure I will not tell it all, like young people are unique, geographically, socially. The demographics mean that, they need different approaches. So one thing is just invite young people to the table. I know the economy is tough. We probably have sold the table, but we have to involve young people, invite them to the table and ask them, what do you want? Like make them part of the conversation rather than just we know that this will work.
How do you want us to make them part of the conversation?
First, just make the conversation youth friendly. And I like that this show, for example, is on social media. So they might not even want to watch TV. They definitely do not. We definitely do not read newspaper. So bring the conversation on TikTok, for example. Bring it on social media. Let young people participate on YouTube. And during policy frameworks and formulations, meaningfully seek the information or feedback from young people. How do they want, for example, is the simple things, the feel and look of product, for example, packaging, branding, tone, language, for example, PrEP. Let me just give an example of one of the young people we are working with who we gave a grant to in the Ray 30 Under 30 award. So we have a young person who's working with male champions to create an atmosphere for women who are on PrEP to just be comfortable. So working with husbands or partners or spouses of young women who are on PrEP so that it is more acceptable and it is more effective, because there's a challenge, especially for young women or young wives who are on PrEP tend to want to hide with their
explain PrEP. Not all our listeners may know what PrEP is.
PrEP is pre-exposure prophylaxis. When one
what is a prophylaxis?
Is a drug to protect you before you are
exposed.
Before you're exposed. So when you feel like you're at risk of getting infection, so you take the drug beforehand. So a lot of young women, especially young wives who are in partnerships, who are on PrEP because they felt their partners were posing a risk to HIV infection are on drugs, and so they would not adhere because they would have to hide in order not to be asked or questioned by their spouses. Why are you, if you are faithful and you are not a person living with HIV, why are you on drugs every day? Because PrEP, you have to take it every day for as long as you're at risk. So one of the strategies a young person is doing is inviting the partners so that they understand why their partners have to be on PrEP every day, and this is just a good thing for the family, ensuring that everybody is protected, and so this is making young people more open to taking PrEP and not having to hide and go through the risks of sometimes you have to miss a drug because guests are there, your spouse is there, they're not leaving the house the whole day, and it's your time to take the PrEP, so you probably miss. So when the spouses are in support, that means their adherence is increased, and so makes it more effective.
I know Eric wants to go to break, but
yes, so I'll take the break.
Take it after.
Yes. It's 7:30. It's Kenya's biggest conversation. We are talking about the alarming rise of HIV and AIDS infections among Kenyan youth. What's happening? And that's why we have two people in the studio with us this morning. Professor Elizabeth Ann Bukusi is a researcher at KEMRI, and Winnie Wadera Kiriga is a life skills facilitator and member of Ray Secretariat. We are getting to understand what exactly is happening. What is it that the government and other stakeholders have been doing to sensitize the young people? What is it that the young people are facing? How are we ending up with a rise in infections?
This is the Situation Room, the only way to start your day.
Eric Latif, CT Muga, Ndu Oko, and our two guests in the studio this morning, Professor Elizabeth Ann Bukusi, a researcher at KEMRI, and Winnie Wadera, life skills facilitator and member at Ray Secretariat. We're talking about the alarming rise of HIV AIDS infections among Kenya's youth. I'm going to be like a dog with a bone on this one, Prof. When Moi said he didn't declare it a national disaster, but he said, okay, let's have programs on HIV, I was a young adult, okay? Today, I have a young adult in my house, and we're saying there's a rise. With all that, there's been awareness. I have come to, know HIV AIDS information with me and carrying it with me wherever I go. These children are growing up in the information age. They have access to information not only from their parents, but from their teachers, from their peers. They have information from very many sources. So the word AIDS and HIV to them are not foreign. How HIV and AIDS presents itself, not foreign. That they have access to treatment, not foreign. That they have access to information, not foreign. Why do we have a rise in infections?
That's an excellent question. Let me say three different things. One, I won't ask you directly because it would not be very fair. I don't know how many conversations you've had with a young adult in your house about this directly. They know, you know, but nobody talks about it. So really the hard conversations, and not the read the newspaper, these are the statistics. The life skills that Winnie is talking about, being a life skills facilitators. What happens when you're at that party and somebody is putting pressure on you? How do you say no if you want to say no? If you're going to say yes, why are you saying yes? If you're saying yes, what protection are you ensuring that you have? Those conversations are not happening, number one. Number two, and I want to take it back to the conference we had a couple of weeks ago because I heard the young people say this. One young lady was talking about how one of the basic challenges, and she did challenges and say, why is it that there's so much that the government makes available, but sanitary pads always have a cost? Sometimes the young women are getting coerced or being induced into sexual activity by needs for being able to buy sanitary materials. As simple as that. Because that's such a challenge that someone can't get out of the house, can't go to school, can't do anything. So just to be able to get basics, why is it that there must be a cost to something as simple as that? Let's take it to the other side of treatment. Again, this is something that I heard at the conference said over and over again. And we had young people who have been infected with HIV from the time they were born. Stigma. A young person talked about how going into a clinic, there was even attitude from the healthcare worker, looking at them like, yeah, you're the people who go and get infected and then come and bother us. This is someone who was born
with it.
Yes. they had no choice. They said it's only after the healthcare worker looked at their file and realized that they had acquired it perinatally. Their attitude changed. Suddenly they were very nice to them. Why should that even be an issue? Why is it that we can't have adequate number of trained staff who know how to treat people with dignity, regardless of? The question isn't where did I get the HIV or how did I get it? I have it. What are you going to do to allow me to be able to have a normal life despite the fact that I have a lifelong infection that I have to live with? So the economic pressures, the social pressures, the issues around our healthcare facilities, are they available? Are they accessible? Are they friendly? Do they make those services available in a friendly manner? That is the issue. Right now, we've actually had a challenge with even accessing testing kits. You may want to get it tested, but you can't. Those are real problems.
Have we left the foot off the pedal?
To some extent, yes.
Who's we?
All of us. Every single one of us. After all, when we talk about our government responsibilities, isn't it you and me who vote and then put governments in? So it's our responsibility. Every single one of us.
You know, in the early days of HIV care and treatment, there was a very, very big push to ensure that people who actually handle, manage patients or people who come to the clinic for testing were trained appropriately. There was adherence counseling that I think is still being offered. There was couple counseling. There was discordant couple counseling. There was basic HIV and AIDS counseling. And there was even a push to ensure that anyone who came across patients who might need attention in this particular area was trained in counseling. Now, I'm not sure whether that insistence and that push still exists. But stigma has always been an issue. And in my mind, stigma is an issue because HIV, the predominant conversation that isn't spoken is sex. And people are uncomfortable discussing sex. So whatever discriminatory attitude someone has, they come with them to the clinic, even if they're a caregiver. In fact, I think in the early days, one of the things we found, some of the biggest hindrances to the receiving of care and treatment the mother was in the manner that was appropriate were the healthcare providers, because they are the ones who had issues, not necessarily the patient. Because someone comes in and they're telling you about these problems, and partly you can reflect on your own issues pertaining to what you're being told, and it was a bit of a mix. I'm not sure we ever actually got to a point where we could say we had slayed that particular dragon and overcome it. Because biases are an inherent part of human nature. We tend to be biased. So now it's a question of just finding an appropriate bias to fit that particular situation.
Even as we talk about there being an overwhelming number of younger people who have been infected, we are saying that as time continues, that there are more and more who are still getting infected. Is that what we're saying?
What we are saying is, when you look at infections, new infections in this country, which is the group that has the highest risk, that is contributing the largest numbers to new infections?
Okay.
It is individuals aged between 15 and 30.
What is the main reason why young people are not protecting themselves when they're obviously engaged in sexual activity?
Now, that's why we are talking about Ray. Nothing about us without us. So you need to speak to this. This is your age demographic. I am not in that age demographic anymore.
Because I mean, because we're saying, look, let's just be plain and simple here. Why are young people not using condoms? Why are young people not having these conversations? Why is this not taking place?
Good question. So, like Mr. City said, the predominant conversation here is sex. So, every other factor aside sex, there's just general negligence amongst young people because of lack of right information. We always tend to think that it's just HIV. I don't think it can knock on my door. I don't think you don't look like you're infected. So, we meet at the party, you're looking nice and all. I don't think you look healthy to me,
Yeah.
So it's just negligence and apathy, just living for the moment. Just living for the moment. It feels good now. And so just living for the moment. We don't really believe in, going for testing.
Or I'm also thinking about the scenario where these young people that we're talking about, between 15 now and 25, at the time when we were in the throes of HIV, they were babies.
Someone's born.
Some were not even born. So they did not have this active conversation. It was not, the ABCs were not everywhere for them and all of this. And by the time they got to this age, the foot had been taken off the pedal. The community conversation was not around HIV. So they've come back into a time whereby the conversation is not front and center. And the natural inclination then is to go towards having this carefree approach towards sex because
It's no longer
front
carry.
and center.
That's true, because I remember when growing up in primary school, we I think till like still at junior primary, we still had photos in school of HIV, AIDS being like a dragon, and it was scary, and you'd see billboards all over the place along the road where it was like a big red ugly dragon, and everybody was like, if this dragon bites you, like your shoulders would be pain, and your shoulders would be like lifted. So it was like really, really scary. So everybody was like, oh my god, this is such a, you don't want this to catch you. But now, because of the we've reviewed how messaging,
The communication and messaging.
and so it's subtle, and so you're right. So now, as young people are growing up, they don't have that imagery that there was back like 20 years ago, maybe 15 years ago, and so now the damage does not look that bad. So that's, and there are young people who've never like really seen this kind of very, very ugly. So there's like, this is.
Would you then say that the unfortunate situation here is that the ARVs and the availability have actually contributed, unfortunately, to this situation? Because what is there to fear? I mean, after all, you're not going to die, you're not going to grow thin, and ARVs are free.
You will live with it.
You live with it.
You know, that's a good way to put it. But before maybe Winnie contributes to that, let me just say, but the scare tactics in and of themselves are not always the best way to give a message. That's why we are saying nothing about them without them. We need to know what's the new way to communicate these concerns. Being told, be afraid. I mean, how many people have been told sex is bad? Then they discover, these people were cheating. This is fun stuff, you know. So the scare tactics are not necessarily the way to communicate these things. I also want to put a disclaimer that we need to remember that young people, before they get to the age of 25, we used to think teenage was the time when brain development happened, and then by the time they're 18, they're fine. They're not. Until you get to about 25, your prefrontal cortex has not developed all the connections it needs to with what we call your limbic system, the place where emotions develop. That's why these people do crazy things. That's why accidents. In most developed countries, insurance for people under the age of 25 is very high because they know they are high risk. They make decisions in a different way from older people. I'm sure the speeds you drove at when you're under 30, right now you can't drive at that speed. And when you're under 30, just for the fun of it, for no other reason, then that you could try and see, can this reach 180 if that's the maximum? So their decision making is very different. We need to recognize that happens all the way to age 25. But Winnie, you are going to talk about these care tactics.
And I want to bring in Dr. Kawango Agot, who joins us now on the line. She's in Kisumu. She's the Director of Impact Research and Development Organization. Good morning, Dr. Kawango.
Oh, hi, everyone.
Good morning, and thank you very much for joining us. We wanted to have you on video link, but unfortunately, some technical challenges here and there. Nevertheless, you're here on the show. You've been hearing the conversation as we've been having it for a couple of minutes. Winnie was about to come in and contribute about, the new way of communicating to the youth. From where you sit, Dr. Kawango, you also look at how best to communicate, how best to engage. What is the new age of communication with the youth? What do they want to be told?
I think before you know what they want to be told, we need to get it from them. Because what we've been doing, we have the social media, we have the things that we are saying, the outlets that young people like, but what content do we put there, and who puts the content, and how do we package that content? And that needs to come from the young people themselves, because we've done that a lot in the past where we think we know what they need, we think we know how to package it, we present it, and then they don't take it. And that goes not just for the messaging, but also for the interventions that we come up with. and that are really effective, that, we've done so much work on it, and then you bring it, you put it on the shelf, and nobody's picking it up. And then we ask why. It's because we didn't engage them at the beginning to see how to package that intervention in a way that they would love and they would want to work with, and that would fit into the challenges that they're going through. Like I've had in the conversations that Prof and Winnie have presented, that we think we know, and then we realize we have this very effective intervention, and then we are stuck with it when the people that are at risk are not using it. So let's get it from them, what they want.
I'm sorry, Doc, but I've got to push back on this. Let's get it from them is a conversation that always happens. I mean, you are in research. Prof, you're in research. That's what you would be expecting that you'd be doing, getting it from them. When a facilitator is engaging with the youth on a daily basis, that's what you should be getting from them. Why are we still talking about let's hear it from them? What have you been hearing from them?
No, how do you get from them? We can give them to get the facts that we need. Does it work? We give you the pill. You use the pill, and then during the time that you're in research, because we have incentives, we give you fare to come, we compensate for your time, and we see that it works. That's all. That's not like what we're going to use at the end. Then you take it to real life out there. There is no compensation for time. There is nobody to call you every one monthly and so on. And then you realize the general public don't take it. And you also don't even take it outside when it's in the general public. And so there is this conversation that's coming up that's called that end user engagement or co-design, where you design the intervention together with the end user. That end user can be a young person, it can be whoever is the target group. You have to engage them at the development of the intervention and not at the end when you've already developed it.
So what you're saying is that a 360 approach, whether it's the development of the drug, whether it's the development of the intervention, whether it's development of the process, young people have to be engaged. How do you do this in a way that guarantees that you actually have captured the requisite views of young people?
What we have done and what is increasing now among these class is that as you're thinking about the intervention, you're looking ahead. You're looking ahead at who your end users are. Then you bring them on board and you talk about these are the interventions that I'm thinking about. These are the products that I want to introduce. What would you like about them? And then you pull out the different components. You pull out the different structures, the shape, the size, the taste, the use in terms of the regimen. Is it daily, twice a day or something? And then they interrogate all those components, all those characteristics, and then you come up with what would work most with people. And this is what now you sell to the manufacturers, that as they're manufacturing, they consider the end user views and preferences.
Maybe if I could add to that, another important component is getting the young people themselves to do the work. It takes a long time to be a researcher. It takes many years of training. By the time you get there, you still have ideas, but really, we know if you think about most of the innovations, they happen when people are somewhere between the age of 18 to 25. Young people who get brilliant ideas, maybe sometimes even quit college or don't want to quit college because they have something that's burning. So getting people at that young age to start to get involved in research. And that's where the 30 under 30 that Winnie was mentioning came in. We had funding from the Bill and Melinda Gates Foundation to fund 30 young people with innovative ideas. People who had never been involved in research, never been funded, but they have a great idea about what to do in their community, either in terms of prevention of HIV or providing care or ensuring people stay in care. And then the idea was fund them to do the research, to find the answers, or to implement these innovative ways that could make a difference.
Can you tell us one of those ideas?
Winnie?
So one of the ideas is working with men to champion for menstrual health management. So working with boys and men to wipe out stigma for girls in the menstrual age. And then another idea is working with male champions towards PrEP. Another idea how to harness social media and the hype around social media to educate using SMS to reach the unreachable, those who are not, virtually placed, to remind them about, services from health facilities, running advocacy campaigns around abstinence and waiting before sexual activity. Yeah, quite a handful.
And one very interesting one is called the combo pack. And combo pack is where a young person is designing a bag that has a pill inside, it has a clock or a watch, and then it has water. Because the issues that are around not adhering to medication is like, oh, I'm in the wrong place, I didn't even know the time, I'm in the wrong place, I don't even have water where I am, or I forgot the pill in this place. So what about if you have a pack where you have those three inside, and this pack is where there's your lipstick, there is your other things, and so nobody knows what is in that pack, and it's designed in a very nice way that people don't know, and she's trying to see whether would that improve adherence to ART.
Dr. Kawango's comment just reminds me of one of the things that stood out for me in the conference is a young person who talked about taking ARVs, and he was someone who, again, acquired it when he was born. And he said in the secondary school where he is, it's a challenge for him to take his medicine because he's stigmatized and people don't understand. And he says, I have to go and hide in the toilet. And then people want to know, why was I carrying water to go within the toilet? Again, stigma remains a real challenge.
Well, I mean, I remembering that, one of the ABCs was then that behavior, right? And so then we obviously the physical action, of actually protecting yourself seems to have difficulty because there's pressure, etc., etc. So it seems as though if there was an overall mind shift, and it's across board, like you started off the conversation with, that it seems that will be the one that then inadvertently brings down the number of cases, but then again changes the mindset. And for me, it goes down to as young as school children and parents. And like I said, having a difficult conversation sometimes is the best conversation because it has to be had. And when we look at interventions at that young age, do you think we need to get uncomfortable to the point where we're having conversation with children and then getting up into that age? Because we know that once children get it at a young age, and I'm talking about information here, once children get it at a young age, they're likely to carry it through later.
True. And parents are a target. Every parent who is listening to this needs to actually ask themselves, have I had a conversation with my child or with that young person in my life about this? Right from the early age and right from when they start, because they get curious and they ask those questions.
And what ages are we talking about?
We are talking about the moment a child asks you about where did I come from? Please don't say the supermarket. That's where we need to start.
Start teaching them from the very beginning.
From the very beginning, and make sure that they understand your values. Parents are afraid of talking about this, but the reality is your children want to know, what is your stand? What do you believe? Why do you believe that? What is your choice? And then if they understand those values, you'll find actually they do want to adhere to them. There may be all the temptations and everything else, but if they actually believe, I'm surprised at how many teenagers, I teach Sunday school, by the way, that's one of my most favorite things to do, let alone the research work that I do. And one of the most exciting things is that young people actually say they want to know what their parents want to know. I can't count the number of teenagers who have said, when I thought about what my mother had said or what my father had told me, that itself was enough of a reason for them to change their mind about a certain decision. They care.
Very well said.
And just to add to that, I think children learn most from what they see their parents do than what their parents tell them. And so I want to believe that one of the barriers to having this candid conversation at home is the parents know that they're not living in integrity. So So before you tell me anything, you have to check yourself, because I know what you do. I see you. I see what time you come in. I see the kind of people you work with. I know what you drink and all that. So sometimes I think that probably stops parents from because they already feel guilty before they even begin the conversation. And
they don't have the moral authority.
Or when you begin
bring in these issues.
Or when you begin the conversation, now you have to be accountable. Now you have to change your lifestyle and you have to live like what you're saying.
Yeah.
Because really,
it's tough one. Dr. Kawango Agot, Professor Elizabeth Ann Bukusi, Winnie Wedera Kiriga, thank you very much, ladies, for speaking to us this morning. It's a big conversation which we must continue having in days to come.